Hi, my name is Audrey, and I'm here to do an oral presentation regarding the topic on what are the lapses in signs of depression in adults. Firstly, let us understand what depression is. Depression is known to be a state where one has low mood and disinclination to activities. This state of being can affect a person's thinking, behavior, and emotions. This is the outline of my presentation, and basically, I'm just going to talk about the factors and the signs of depression in adults, and then leading to the lapse in signs of depression. Firstly, what are the factors leading to depression? Depression may be a result of these factors. Firstly, when personal or certain expectations concerning education, career advancement, marriage, and starting a new family, all these needs are not met. This is seen to be more prevalent among young adults who are entering into a new and multiple transitions in their lives. Second factor that leads to depression can be due to certain environmental factors such as living alone, work environment, chronic illness, sleep disturbance, and financial strain, exposure to violence, poverty, domestic abuse, and even sexual violence. Moving on to the signs of depression right now. The common signs of depression are such. Firstly, impetuous action. Impetuous behavior is often seen in assessing the depressive mental state of an individual. Impulsive anger outbursts and violent behaviors are possible signs of depression, and they must not be misread as just a person acting in a particular situation without putting much thought to it. Second sign of depression will be anxiety sensitivity. Anxiety sensitivity is the fear of physiological arousal related to the experience of anxiety. And factor analytic approaches have typically identified three depressive symptom dimensions, and they are the cognitive, affective, and somatic symptoms. Third sign of depression is suicidal behavior. Suicidal thoughts tend to be a result of one who suffers helplessness and disheartenment, and once convinced that there is no more hope for the future, one may be at the verge of reinforcing suicidal ideas into a suicidal action. When people exhibit all these signs of symptoms, psychologists and counselors are then able to diagnose that they are depressed. However, there are certain people that do not exhibit these symptoms that were mentioned, but they may actually be depressed. And this is what my presentation today will achieve. Why certain people who may actually suffer from depression, even though they do not exhibit the common symptoms of depression. And I have three main points today. The first point is people mask their depression due to gender stereotype. There was a study done to find out if male clients are generally open to share what they are struggling with in a counseling session. And the findings is such that many of them, they tend to be reserved when dealing with their emotions. They can appear to be coping and managing their pain, but in actual fact, they are masking their depression. People mask their depression due to societal stigma. Depression is largely seen by the general public and mainstream media as a neuropsychiatric illness, which is best described as disorder, episodes, remission, relapse, and recurrence. And people, they naturally tend to modify their behavior to adapt to their social environment. This may involve hiding the true extent of their own feelings. While altering the social presentation of emotion may be a part of everyday life, this can be especially problematic for people with depression, particularly since people are often hesitant to ask for help given the societal stigma of mental illness, which further decreases the probability of accurate diagnosis. Secondly, people may be depressed even though they do not exhibit the common symptoms of depression because they may just be overlooked. There was actually a study done to prove that detection of depression is difficult, especially in older persons, and this study was done in a nursing home where the quiet residents or the introverts, their depression tend to be overlooked. Thirdly, certain people may be depressed even though they do not exhibit the common symptom of depression because clinical standards for diagnosis are subjective, inconsistent, and imprecise. Although the assessment of behavior is a central component of mental health practice, it is severely constrained by individual subjective observation and lack of any real-time naturalistic measurements. Although there is a wide range in both the symptoms and severity of depression, it is generally agreed upon as per DSM-4 that to be diagnosed with depression, a patient must exhibit 5 or more symptoms. However, depression often has a much more significant impact than just these enumerated symptoms and can affect or be affected by a variety of biological, environmental, social, or cognitive factors. This symptom-based definition of depression makes accurate diagnosis problematic, as it is difficult to objectively measure psychological rather than physiological phenomena. For example, a person visits a psychologist and then complains of several symptoms of depression, but not depressed mood. Another person would label this private experience as depressed, but the current client did not develop adequate private stimulus control over the experience. The psychologist performs a diagnostic interview and the client falls short of one symptom for the diagnosis of depression. In this case, it is advantageous to consider the person depressed. However, the psychiatrist may not do so, resulting in this particular person falling into cracks. So in conclusion, although I am still finding evidence and developing my argument, I want to suggest that sometimes depression can go undetected. Thus, it is important that people be diagnosed and depression be detected, as detection could help break the vicious cycle of depression, leading to negative conduct in self-care, activities, behaviors, which in turn leads to illness and ultimately to a return to a depressed mood. Thank you for considering my presentation and looking at my video, and I look forward to receiving your feedback. Thank you very much.